So if we look at these two main causes of peptic ulcer disease, we'll see that a normal person has a very low baseline risk of getting peptic ulcer disease. Having either Helicobacter pylori or chronically taking NSAIDs increases your risk 20 times, whereas if you have both of these symptoms, it increases your risk 60 times. All right. Second main disease of the stomach, or a second main symptom of the stomach, is gastroparesis. Gastroparesis refers to a decreased motility of the stomach. The stomach has to use the muscles around the epithelium to churn up, to mash the food around, to mix it up with the acid, and to push it into the small intestine. Unfortunately, sometimes there can be dysfunction with gastroparesis, and this can cause symptoms such as nausea, vomiting, satiety, or like fullness even when you haven't eaten very much, and bloating. Eventually, these underlying symptoms can also cause gastric cancer. And the cancer types are determined by what kind of cells they are affecting. For example, if they affect the ECL cells, they're called gastric carcinoids. If they infect the immune cells in the stomach, it's a gastric lymphoma. Whereas for normal epithelial cells, it would be called the gastric adenocarcinoma. And this can usually present with weight loss, bloating, vomiting, fatigue, tiredness, anemia, and also dyspepsia. So finally, in addition to the diseases, let's talk about the drugs. Oops, this blue isn't very good on this background. It doesn't show up very well. I will go back. I'll use green. Green is good. I think it's very important to pay attention to drugs of the stomach because a lot of these are over the counter. Whether you want to be a physician, a lot of patients will come in and use this, or whether you're actually a patient that has stomach symptoms. You should get a sense of how these drugs work and what kind of side effects they have so you can properly decide what you want to take. So, broad strokes, there are histamine receptor antagonists. These act on the histamine receptors on parietal cells and elsewhere and decreases the amount of histine that the parietal cells see. This is effective to decrease the amount of acid up to 75-80% of people. And this is very effective, where a very good side effect profile. There are very few. It's very unlikely. And examples of this drug are cimetidine, ranitidine, and a couple of others. And they're most effective for nighttime gastric GERD or gastric reflux, because at the nighttime there's very little mental thought given or causing the amount of acid secretion, but a basal level that is caused by histamine. And this typically is enough to heal people in 70-80% of the time. Unfortunately, the drugs in this class, the histamine receptor antagonists, are acted upon by cytochrome P450, which indicates that there might be some cross reactivity when you take something like warfarin, lidocaine, or theophylline, which are also regulated by this liver enzyme. The second main type of drugs are the proton inhibitors, which are drugs that specifically bind to the proton pumps, the potassium proton ATPases, and prevent secretion. This is the most effective drug and works 90 to 95% of the time because it works on the final downstream effect. You see, even if you have a histamine receptor and a histamine receptor blocker, you'll see that gastrin and a couple of other things can still cause acid secretion. But if you act on the final thing, no matter what else is happening, there can be very little excretion. Drugs in this class, such as omeprazole or Prolosec, or Prolosec and Nexium as its trademark names, are very effective, and they're generally known to have three main features that make it almost perfect, or one of the best drugs available. First, it has a very short half-life. The drug is actually very quickly discarded in the body. But this works to its benefit because there are very little cross-reactivity. Second, it's concentrated at its site of activity. You see, this drug, when we ingest it, does not actually go straight into the stomach. They're usually encapsulated so that they're not digested, and then moved into the duodenum, which has a basic pH that finally moves it into the bloodstream. When it's in the bloodstream, it moves back into these parietal cells. When it finally, or for the first time, sees the acidic environment, which concentrates it and causes knockout of these ATPases, or these proton pumps. And finally, it has a long action of duration. Contrary to the histamine receptor antagonists, which are competitive, non-irreversible, or irreversible inhibitors, these are irreversible inhibitors which knock out these pumps and causes such that the cell needs to resynthesize more, which can occur 18 to 24 hours later, which means it has a long action of duration, even when the drug isn't actively acting. One of the side effects of proton pump inhibitors is an increase in gastrin excretion. The body sees that there's not as much acid being produced, so the G cells automatically excrete more gastrin. This hasn't been shown to have any major adverse chronic effects in people, but in mice this has been shown to actually increase some types of gastric cancer. Thirdly, we can talk about a different class of drugs that are the protective agents. These are essentially very, very simple macroscopic drugs that can coat the body of the stomach and prevent ulcer disease and gastric reflux. Example of these are the bismuth, which is Pepto-Bismol. So after talking about these drugs that can be used for peptic ulcer disease, we can talk about a couple of drugs that can act upon the stomach to prevent either nausea or vomiting, or too much acid, antacids. So very simple antacids that are over the counter also include sodium bicarbonate, which is typically an Alka-Seltzer or baking soda, calcium carbonate, which is, these are uncharged molecules because they're salt. Calcium carbonate, which is typically in Tums, and because of the calcium, is actually used as a dietary supplement to prevent osteoporosis and to keep strong bones. There's also magnesium oxide, or hydroxide, which is milk of magnesia. Milk of magnesia in large amounts can also cause a laxative effect and cause diarrhea, which is not very good, but is balanced by something called aluminum salts, which are salts that contain aluminum, and also increases the pH of the stomach, but conversely causes constipation when it goes into the small intestines. Typically, the magnesium salts and the aluminum salts are packaged together to balance the diarrhea with the constipation, to have a fairly normal, effective drug. And this is typically in Rollins and Mylantia, whereas the calcium carbonate is in Tums, and the sodium bicarbonate is in Alka-Seltzer. and baking soda. So finally, let's talk about the drugs that are used in nausea. Nausea and vomiting is a very complex Nausea and vomiting is a very complex syndrome that's regulated both by your very primordial brain in the medulla, as well as very cerebral brain. For example, with people undergoing chemo or when they're nervous, they can throw up. As well as if there are toxins, food poisoning, these are regulated by the medulla, your very basic lizard brain. And there are a variety of drugs, which I'll probably talk about in another video, but generally they include drugs that are also that generally affect the brain. So they can be phenyldiazepines, such as Haldol, which is often also used as an antipsychotic and as a sedative. There's benzodiazepines, which is usually used as an anti-anxiety drug. And an example is actually Valium, but used in small doses is typically really good for nausea and vomiting. And also there's a couple of other drugs, such as the histamine 1 receptors, as opposed to the histamine 2 receptors here in the stomach. There's histamine 1 receptors in your brain, and antagonists, such as diphenhydramine, can be used to prevent vomiting. And this class of drugs are known as antiemetics. And emetic means throwing up. So, in summary, the stomach is a really complex organ that is really crucial for the digestion of food. The stomach secretes acid, and it encapsulates food into this muscular organ, which grinds it up, mixes it with acid, and allows the beginning of digestion to occur before it goes into the small intestine. The stomach also needs to protect itself from this very caustic, low pH environment, and typically has a surface of mucus and regulates the amount of acid secreted by parietal cells in the stomach. Diseases of the stomach can occur either through infection, such as Helicobacter pylori, or a dysregulation of how much acid is being produced in the stomach, which can occur with drugs such as NSAIDs, which is really common because NSAIDs are a huge class of drugs that people are use for pain killing. And the drugs that we have to treat stomach disorders act upon this regulatory pathway of the stomach, in which parietal cells are regulated by ECL cells, G cells, the nervous system through the pans, as well as hormones from elsewhere in the body, such as somatostatin, CCK, and secretin.